Okay, well, I just want to thank Tom Kirsch for inviting me here. It's always a pleasure to have a chance to collaborate with Tom on something, and it's hard for me to say no when Tom asks me to do something. We taught a course together, and we've had a lot of great work together. But I will say I wasn't sure what I was going to talk about when I was looking at this topic. And I thought that perhaps what I would talk about, because the National Academy of Sciences, the committee that I chair, just did a very deep dive into all the research after Hurricane Sandy, and maybe I would give a retrospective. And then Harvey happened. And I happen to be from Galveston. I'm a native of Texas. I happen to have an 87-year-old father who still lives there. And he happened to take 40 inches of water into his house about a week and a half ago and called me for help. And from a distance, I had to try to arrange his evacuation. And then this weekend, I headed there for my Labor Day holiday to work on getting him cleaned up, his house, getting his life in order, transportation, all the things that they need. And I realized, well, no, I don't want to talk about it. Past event. I'm going to spend more time talking about the current situation. And so you'll hear a little bit of side commentary for me about some of the things that I observed. But of course, it's way too soon to say that we understand the full impacts of Harvey, that we can actually state definitively what really happened, what hasn't happened. There will need to be many after action reviews. But I also think there's some things that are very apparent, and unfortunately are things, as Dr. Kirsch said, that we've learned before. We learn again and again in the case of major disasters, and that we fail to take the action that we need to do to protect the public's health. I have nothing to disclose. I have no financial interest in hurricanes, particularly. But we do have some learning objectives about and I'm pretty sure, by the way, when I look at these objectives and I look around this room, that all of you probably already know all of this, because if you've spent any time at all around Dr. Kirsch, you do. But on the other hand, it never hurts to review some of these concepts, and certainly to, when I prepared the talk, I even realized these are things that we all need to revisit and take to heart. The fact that preparedness and mitigation are very different activities, that there are major steps that we need to take to assure public health protection, and that there are lessons that are learned with regard to hurricanes, but also that disaster preparedness, while it's a very important part of the disaster cycle, is probably the part that we pay least attention to. For whatever reason, our society invests far more in the mitigation and reconstruction of areas after disaster than it does in preventing them. As a dean of a school of public health, I could say that that's almost a sentence that I could do with a fill in the blank with prevention of any public health hazard, that we're always willing to treat and remediate, and it's very difficult for us to see the value, which is enormous societally, of investing in prevention. But also that awareness and planning among people are important, and that these flaws continue to challenge public health in a major way. Now, we know that there's a big difference between the scale and the impact of events that may occur. And we talk about emergencies as events that are unforeseen and sudden, many of which we can't do a thing about. We can't really prevent hurricanes from occurring, and these occur. And especially in a year like this, which happens to have been predicted as a bad year, NOAA turns out to have been correct. They told us it would be, and it is. That disasters are ones that cause greater damage, loss, or destruction, either because there's a higher intensity or potential more energy in that storm, bigger winds, lower pressure in the eye of that storm, or that they hit a broader area, whether it's a storm or another natural disaster or a technological accident of some kind or a social problem like that we could have, like riots and terrorist attacks, 9/11 being an example of that, the potential actually that the leader of the country of North Korea could succeed in launching a nuclear weapon and landing one somewhere on inhabited land, whether it's ours or someone else. Catastrophes are when these disasters that occur overwhelm the system that is there to respond them. And so I've used this graphic for a long time. A colleague of mine, also from Hopkins, Tom Glass, put it together, a lot of versions of this. But it's a reminder that they're the damage characteristics of the event that, so some events are just inherently worse than others, but there's also the locally available response capacity. So whether something ends up being a catastrophe, a disaster, or an emergency is a function of how bad it is, certainly, but also the function of our ability to respond to it. And a lot of what preparedness is about is trying to move these events down from, instead of being a catastrophe, being a disaster, rather than being a disaster, being an emergency. Fewer people are harmed, there's far less destruction. We know that there's stages, and I know you know about these stages, from mitigation, preparedness, response to recovery. And in fact, that we tend to think of this as being in a cycle. That we go from mitigation to preparedness. We warn, disaster occurs, we respond, we do relief, there's recovery, but it's a cycle. And especially in regions like the Gulf that have frequent storms. Many kinds of natural disasters can occur. Some of these not so natural, actually. I have power outages on this list. We could have massive power outages due to cyber terrorism, not necessarily due to natural disasters. And by the way, there would be enormous public health impacts if we had such events, and I think that we're very vulnerable to them. Large global impact from disasters, and important to remember, although I'm talking mostly about the United States and events in the United States, that the most major impacts on public health occur globally, and especially to poor people. Poor people, whether in this country or overseas, are disproportionately impacted by disasters. The World Bank in 2016 estimated that every year 26 million people are forced into poverty as a result of natural disasters, and that there are $520 billion in losses. Now, these losses tend to be focused on richer countries. Why? Because there's more infrastructure that's more expensive that can be destroyed. And so you do see a funny relationship of poorer countries having more impacts on public health and mortality and people becoming even poorer, and richer countries seeing more in dollar losses. There are many, many impacts. This is kind of a laundry list of potential things that can happen. People tend to think about infectious diseases, and you always hear after a natural disaster many rumors about cholera being spread or other infectious diseases, and certainly that is a threat. That can happen, especially when drinking water and wastewater facilities break down. But you also have to think about more common problems, such as the fact that water and food can become contaminated, a lack of shelter for people, lack of adequate medical care, medical supplies. People worry a lot about decaying bodies if there are many deaths. And we know that that's not a disease risk, but we also know we need to communicate clearly about that, because to most people, that's a disease risk. People understand that as something that's very dangerous to them. And so part of the response has to be to deal with that very quickly, not because it's going to cause disease, but because of the anxiety and the stress that it creates in communities. Infectious diseases have to be surveilled over many months, not just in the immediate time period. Medical supplies have to come in, obviously, restoring infrastructure, and dealing with mental health and social needs. Mental health is obviously a major issue in a country that is experiencing the opiate addiction epidemic that we have. Many people who were relocated from Harvey are in methadone or Suboxone treatment. Their clinics were damaged, were flooded. We don't necessarily have stockpiles of those medications to get to them. We learned that in Sandy. Unfortunately, I think it's one of those lessons that was not translated to the situation with Harvey. and that we're going to have to double down on. We have an enormous addiction problem in this country, and it is terrible for people to find themselves in a situation in a shelter where they don't have treatment. The emergency medical care, we think about the stop the bleeding. Obviously, we've got to do that. There are injuries, there could be burns, there could be other acute problems, and we, as I said before, food, water, and shelter, basic human needs. Preparations for evacuation, relocation, and sheltering in place. I have to say, once again, not very well done in the case of Harvey. To talk a little bit more about that, but evacuation has been a major problem in the Houston region. One reason that my father wound up being impacted by the storm is that he refused to evacuate. Why? Well, several years back there was a storm called Rita. Any of you remember Rita? They were all told to evacuate the Gulf. People got on the freeways and they couldn't get out of Houston even. The freeways were so clogged that people ran out of gasoline. It was about 100 degrees outside. You can't sit in a car that has no fuel in 100-degree weather without being killed by that. So people got out of their cars. They abandoned their cars. And my father and mother at that point sat there for many, many, many hours just trapped on the freeway. Lesson learned, they tell you to evacuate, don't do it. Then what happened? Hurricane Ike came through. He was right in the path of the eye of the storm, just right there. He had decided to shelter in place. The eye passed over. My dad at that point is like 80. He went out and walked around during the eye, went back in the house. Everything was fine. And so, see, I'm right. You don't have to evacuate. They tell you to evacuate, you don't have to. So there he was, a sitting duck, becoming a victim, for this storm, because, the lesson he learned was that you really don't want to go. It's worse to go than to stay. Epidemiological and lab surveillance, including baseline information about the population. It's hard to say what's happened to them if you don't know what their health status was beforehand. And believe it or not, there's a lot we don't know about the health status of populations in these vulnerable communities. Environmental sampling, a lot of that going on in the Gulf right now. Paying attention to occupational health and safety. Joey, who lives across the street from Dad, the night that the flood occurred, he was off at the chemical plant where he works. He had been called in on an emergency basis for an overnight 12-hour shift to shut down the plant. And we know that's very dangerous work, that his life was put in danger because he then had to figure out how to get home. 4-hour drive, that's usually a 45-minute drive, roads flooded everywhere. And he could have been one of those who wound up going in deeper water than he thought he was going in to get home to take care of his wife and the horses and everything else. And that's just a microcosm of really thousands of people who work in the industry who wind up having to be deployed that way. Communications, which in this case were very good, and I'm going to talk a little bit about that, as well as coordination of response, which did not work very well. So we do know, and this is hard to talk about with people in the Gulf, the numbers of Category 4 and 5 hurricanes are rising over the last 35 years. Now, I'm from this community. I am somebody who is in environmental health. I work on issues like climate change and the impacts of climate change. I know I can get that message across. Once I start talking about that's because of climate change, those people are just going to tune out because they don't think it's happening. And I would love to find a way to persuade them of that. It's not that I think that's unimportant. I think it's incredibly important. But I also know, among my daddy's neighbors and a lot of the people in his communities, that once you do that, their minds will shut down and they won't listen to you. And so, I think we can get this message across. But unfortunately, I don't think that we can get many of them to contend with the issue of why. And the longer term issues, even though I'm very sure that we must do what we can to address climate change, because this situation is getting worse and worse. As I'm going to show you, it means that our weather is getting less and less predictable. So I grew up on Galveston Island. This was the sentinel event from my community, the 1900 storm, which nearly destroyed everything on the island, killed thousands of people, and forever shaped history there. The commerce that had been there, it had been the center of commerce in that region, moved up the bay, up the Houston ship channel, into Houston, which was safe. Now we see it really wasn't all that safe, but at that time, that was the idea. Just go up a little ways and it is safe. And Galveston is still a thriving town. It was rebuilt and all of that, but it was never the same place. Never the same place. So what do we do? And certainly they've done that around Galveston and the Gulf. I mean, we try to identify coastal areas at risk. Again, going back to the climate problem, this has become a political issue. I'm outraged about this, but the idea that FEMA, in identifying areas at risk, cannot use climate prediction as a way of saying what areas might be flooding, that is ludicrous. We are not protecting people when we provide them with flood maps that are incorrect. That is a wrong thing to do. And then we insure them for flood risk, and who pays for the flood damages? You and I do, all the taxpayers do. We're not helping those people, we're not helping our country. But this is, unfortunately, an issue that has become polarized along political lines when it really is a public health issue. It needs to be dealt with as a public health issue. Land use planning goes along with that. A lot of people are opposed to that. Building levees and seawalls, I grew up behind a seawall, and it does help, trust me. It doesn't do everything, and in the case of Galveston, a lot of the natural environment has eroded away. It's become more vulnerable. Sea level is rising, but nonetheless, New Orleans as well, good levees are helpful. Establishment of shelters and evacuation routes. I just ask you to look at what's happening right now with Irma in Florida, where they have a system of evacuating people that is to die for. If only they had a system like that in the Texas Gulf region, where it's very clear to people how to go, where to go. All the traffic on the freeways is turned in the direction away from the storm. It was Hurricane Andrew that made them do that. They learned that, and maybe now Houston will have learned that from this. But why do we have to learn because the hurricane hit us? Why can't we learn because the hurricane hit Florida and people were unable to evacuate and people were hurt? So everybody along the Gulf needs to establish these routes. For whatever reason, it's not how the human mind works, it's not how the human political system works, but we need to find ways to communicate this to policymakers, that the lessons that are learned in one location need to be applied in other locations. During the event, the storm tracking, which has gotten better and better and better over time, the warnings, I hate to tell you, Houston, you probably heard this. The mayor told people one thing and the governor told them another thing. That does not happen in Florida. That can't happen in Florida. But it happens in Texas. It's terrible. What do you do when you're hearing different messages from different authorities, and then you already think it's just too hard to leave? And securing items, making sure your glass isn't going to break and blow around. That's what I grew up doing. Every few years, we just hauled everything in, taped the windows, got in the car and left. That's what you do when you live in hurricane country. We have a lot of science around warning people, and we have learned, and this is just an example of one study that was on tornado warnings, that people who are warned and who obey warnings are more likely to survive without having injuries. And in the case of this particular enormous tornado, I don't know if any of you remember this 1999 one in Oklahoma, that there were 65 houses, 190 people who were warned, and 47% left and went to shelters, and the rest didn't. Those who fled, none of them were even injured. They weren't even hurt. Those who stayed, 30% were injured and 1% were killed. And people, you can go back and study why people didn't leave in this particular event, and I think that this is very true for many people, why they won't leave. They think the storm won't actually hit them. They think it's too late or it might be too dangerous. They don't have transportation, and/or they don't understand where the shelter is and how to get to it. So, the whole warning process is very important. I happen to think we in health need to be more involved with it. Not that we would do the forecast technology and the systems, but how do you give the advice, the step-by-step instructions that are clear enough, and particularly the instructions that are around your medical risk. So I met people who knew to take their medication, but they didn't have it secured in waterproof Ziploc bags. When your pills get all wet and gloppy and mushed together, they don't help you anymore. And so what I mean by specific step-by-step instructions is down to that level of detail. Not just grab your pills and put it in your go bag. There are a lot of myths, and I've been in government, both in the state and the federal government. I've experienced this a lot with my colleagues. Many of you work for the government. You may recognize some of these ideas. Sometimes I have these ideas. Some of you have had these ideas. We think keeping it simple is better. And so sometimes we fail to provide adequate information because we don't respect that people can understand a more complicated message. We think that people will accuse us of crying wolf, that if we've warned and then it doesn't happen, they won't listen to us the next time. We think that the public will panic and be hysterical if we tell them the truth. That actually, there's a lot of science around this. That actually doesn't happen. People panic and become hysterical, certainly, if they get trapped on a freeway and it's 100 degrees inside their car, yes. But they don't panic because we've been truthful. They think people will not make a reasoned decision, that they won't do anything anyway, that we underestimate the ability of people to make a reasoned decision. Most people, when given information, actually make pretty damn good decisions. So there's a tendency, and I'll include myself in this, and most of you too, we all, as experts, tend to tell people too little, and we tend to tell them it too late. Citizens and the networking that people have among each other has always been recognized as an important issue. The science shows again and again, but I think Harvey is going to show us that this has become even more important. And that is that people are more likely to hear about it if they have a strong social network. And now we have Facebook. And that really intensifies the ability of people to learn about what's happening. They use their social networks to relay and receive information, that they observe social cues. So, I myself called a really good friend of mine who lives in the Miami area, who has an infant. I called her yesterday morning. And what are you going to do? Well, my husband is worried that when the storm comes, we're going to have looters. He wants to stay here and defend our home and our property, okay? And I was like, well, that might be okay for him. Probably not, but you and the baby, need to be out of there. Your baby isn't going to take arms in hand and start shooting at looters anyway. You need to get out of there. And she listened, and she's out of there. She's somewhere else. And she, she emailed me this morning to say, that call from me made a difference. And it's how the social networks actually work. And the personalization increases the likelihood of responding to it, but also when families are united, they're more likely to do the right thing. So you separate people. And this happened actually in Rockport, Texas, after the landfall of the hurricane. This poor gentleman struggled to get all the way back there into the scene of the destruction because he thought his elderly father was still there. He didn't know his father had been evacuated elsewhere. And he shows up there, only to find that his dad is gone. But people this is human nature. And so connecting people is so important in terms of being able to care for them and to care for their health. We've also learned actually that the same thing can be true of household pets. And that is a lesson we've learned, that there were people who did not evacuate Katrina because the shelters wouldn't take, little Spot and their little kitty cat. And they will take, dogs and cats. Now there's a limit to that. The fellow across the street from my dad has horses. No shelter's going to take the horses. Role of cues, certainly people who are closer to an area are more likely to respond, and the more environmental cues that people can actually observe themselves, the more likely they are to respond. But also their perception of vulnerability. It's actually interesting to know that research would show that people who live in mobile homes are aware they're more vulnerable, they're more likely to evacuate, which is a good thing. and I think an illustration of the fact that people are actually smarter than we give them credit for. But also the greater their perception of risk, the more likely they are to respond. So we're all calibrated differently in terms of risk perception. The case of my friend and her husband, they have a different calibration, right? I mean, one of them much more worried about the vulnerability of her and her child, to loss of power or the water, and him much more concerned, well, no, it's not the storm, it's the looters that bother me, And the people are more likely to respond if they have kids or somebody who's medically vulnerable, and the more caregiving responsibilities they have, the more likely they are to respond. And the more experience they have, the more likely they are to understand that. And that's partly a matter of the fact that, look, if you just move to the Gulf and you've never been in a place that has hurricanes, you certainly don't have the lifetime experience that I have of kind of preparing for storms, where it's just normal, to do that. And it's hard for people to kind of learn a new thing when they go into a new environment. So there's some points about risk communication. One is that people actually do want the truth, but two, that they can only absorb a limited amount at one time. Give it to them in packets, in bullets. That's not to say don't give it to them, but don't give it to them in long run-on sentences that most people, can't understand. Some information is hard for some people to understand, for sure. Emotions can cloud their judgment. So it's important that the messenger be compassionate and clear, but not emotional. If you deliver emotion with a message, people may pick up on that rather than on the words that you're saying. And that, I think, is very important. And it is very hard to predict how people will respond, and but that, we have learned that generally people make sensible decisions if they have adequate information. So, some of the issues with the evacuees, and we're certainly seeing this in Texas, I've mentioned the separation from your loved ones, situational stress and depression, which my psychiatrist friends tell me is not the same thing as PTSD. It's an area that needs much better research, and we easily can find out about the stress people are experiencing when they're in shelters, their admissions to emergency rooms, but what are the longer term impacts related to stress from these events? They must be enormous. And then how much actual PTSD occurs? We know there's some, but we haven't really gotten to the bottom of what we can do to prevent it. Injuries, which I know many of you know far more about than I do. Food and drinking water shortages. We see right now in Beaumont, Texas, an entire drinking water treatment system that's out, and if you have to bring in all the drinking water for people, that's very difficult. Acute illnesses that can happen, especially illnesses like myocardial infarction. We even see that with earthquakes. People are trying to run away from a vulnerable area and have a heart attack. We have complications of chronic disease, which I think more and more and more we're appreciating. Boy, if they don't have their insulin, they don't have their hypertension control drugs, how serious that can be. And the loss of not only medication, but also critical access to devices. Many post-evacuation needs. I'm not going to read the whole list, and this is not, a complete list of everything that all people need, but it is to say that it's an incredible challenge of coordination. There's the people who see to these different needs. It's an alphabet soup of federal agencies. It's numerous not-for-profit organizations and community organizations. They are local, they are state, they are federal, they are private, they are faith-based, they are not faith-based, and piecing these things together so that people get a coherent package of everything they need to protect their health, the health of their families, is extraordinarily difficult. So I want to go into the issue of lessons, and why is it that every time we have a disaster, we have the same wake-up calls. And I would say one thing that Dr. Kirsch said is certainly true, that we tend to do the same research again and again and again. Now, that's one thing that our standing committee has been working on, and one reason why some of the same research is done again and again and again is that we haven't formed a strong network of disaster researchers who even understand what the literature is in the field, are aware of what's been done before. And I think your center is extremely important, and the work that you've done to review that and to understand the state of the science. Because what happens is that the people who happen to be there say, well, this is really important. I need to do a study. And they don't know anything about all the literature on earthquakes, tornadoes, natural disasters of all types that have been done by people over the years. They go, well, maybe I can go cobble together some information out of the emergency room admissions here, and maybe I can get some data from the city, and I can take a few water samples there, and it's not very systematic, most of it, A, but B, also, it's not informed by what we've learned before. And we know that we aren't advancing the state of the science unless we build on it. And so, again, kudos to you and to Dr. Kirsch and all of you involved in the center for creating that and positioning yourselves to be able to do that. Unfortunately, also, we learn things, we don't necessarily apply them. So, Hurricane Katrina, 2005, it's a little bit, some time ago. And we know the levees did not adequately protect them. So this is an aspect of preparedness that failed. These are flooded areas of the city of New Orleans. You're all aware of how the neighborhoods flooded and what the impacts were, and many of these still are uninhabited areas. And the people, ironically, who lived in some of these neighborhoods eventually were evacuated to Houston, where they have been flooded again. This is an element of this tragedy that is just terrible. Basically, the lake, completely overflowed, into parts of New Orleans. And they had the shelter of last resort, which is the New Orleans Superdome, which was in no way adequate for the numbers of people, because guess what? People didn't evacuate. They were told to, many people did not. And they had a hell of a time getting to the shelter, many of them. Their streets were flooded, freeways were flooded, people were stuck on roofs and overpasses. Many of you probably remember that. And then once they got here, they were in a place that didn't have enough drinking water, did not have adequate sanitation. There were numerous problems, social problems with crowding and conflict that happened among the people there. And so as I said before, people do panic, but not because of what you say to them, but because of what you do to them. You can create panic. And this is a scene from the evacuation of the hospital at the Tulane Medical Center. Lessons learned. Well, we already had learned that from Hurricane Allison in Houston, but they had to learn it again, which is that if you have critical infrastructure for your hospital that can go underwater because it's on the lowest level of the building, you may lose power, you may not be able to take care of people who require ventilators and other assistance. The building also got pretty damn hot, I heard from people who worked there. It was actually too hot for patients and for workers. And so this is the way that one at a time, people had to be evacuated from that, and they had to find hospitals elsewhere for them. And of course, those who are the youngest, the oldest, the disabled, those with special needs were the most severely impacted, always are. Okay, so Sandy happened in 2012. So we should say lessons learned. I'm sure that none of those things that happened in New Orleans would have happened, especially, up in New York, New Jersey, except number one, there seemed to be a lack of awareness of the actual risk in terms of the elevation where homes were built and the potential to have an enormous surge and lots of rain in a major storm, A. And so B, neighborhoods were not only wiped out by wind damage, but also flooded. And oddly enough, many of those people were not evacuated. Now we could see that hurricane heading toward that coast. I showed you the picture. Everybody could see that. And this is not something like the Gulf Coast area in Houston where everybody has to funnel through just a few highways to get out. There are lots of ways to get out of these areas if you've ever been, in or around New York. But it's never happened there before. They didn't think it was going to cause any damage, and a lot of people were hurt in a lot of ways, including just the stress that they experienced from riding out this storm. Well, of course, the medical facilities would have been secured. We learned that with Allison, we learned that with Katrina, of course, except they weren't. And critical infrastructure for hospitals was flooded. Hospitals like Bellevue here lost power. This is a premature infant being bagged as it's being evacuated down a staircase from a hospital that does not have power. Why? I mean, you know, why in 2012 would that happen anywhere in our country? But it did, and fortunately, I mean, there were a lot of people who were very heroic, and look, you know, that region, there were a lot of areas that were not damaged, and so there was the capacity to absorb those. It wasn't like New Orleans that way. So now I come to Harvey. Again, you know, a lot of, in a way, unavoidable destruction. This is where it made landfall in Rockport, Texas. And you can see the wind damage, and, but there's no flood protection around these buildings or these homes, none. But I don't think there's much you could have done about all this wind. A lot of people did not leave. I think the mayor of Rockport gave people a very clear warning, because basically, and I have to say this is Texas style, he told them, you know, take a permanent marker, you know, if you're going to stay, take a permanent marker, write your social security number on your arm, so we'll be able to identify your corpse if you die. That's, you know, tough love, Texas style. What can I say? Again, you know, communities were not evacuated. This is a photo taken in Houston, Texas. And you can see people struggling to make it to higher ground, to get to a place that's safe. And oddly enough, you do notice here, you know, there are few people who look like they're part of the official government response. It looks like it, you know. But there are a lot of people here that don't look very official. I mean, that doesn't look like an official government boat, you know. So that's kind of interesting. But again, you know, the failure to evacuate put an enormous number of people at risk. And there obviously were not preparations by the government to have a lot of boats to come in and get people. There really weren't protections along the bayous, and the rivers, the reservoirs were there for flood protection a la 1940. A la 1940, not a la 2017. So, the freeways were inundated. I actually believe that this is a bayou, but these are roads alongside of it, and this is the city itself. And of course, the hospitals all would have been protected, right? Well, actually, downtown Houston, where the flooding happened with Hurricane Allison, so the Texas Medical Center, UT, Baylor, MD Anderson, they had done a lot of work to harden their facilities. They had moved the critical infrastructure up. They didn't think about some things, like MD Anderson wound up with this huge moat around it and no one could get in or out. Patients couldn't get in or out. Families and the workers couldn't get in and out. If you worked there and you were there, you were there. And you know, that's how it was until the waters went down. But outside of that magical ring that had, even within that region, people didn't take the action they needed to take to protect the medical infrastructure. A hospital in Beaumont, Texas, that was completely shut down. Same problem, same problem. Beaumont, it's right on the coast, guys. This isn't like some place where you'd never see a hurricane. Again, you know, having to evacuate the patients one at a time. We saw nursing homes. This particular nursing home that many of you probably saw, it's a famous tweet that went around the world, but this is the same bayou that flooded my father's house, by the way. This scene is from about 2 miles away from him. One-story facility, you know, you get that 40 inches of water in there. You aren't going to get these guys on the roof. You know, what are you going to do? And so they tweeted it out, and actually rescuers did come, and this is the whole group. After they were rescued, you know, they were fine, but a couple more feet of water, guys, those guys would not have been fine. They were not going to be able to kind of swim out of it. Record-setting flooding like no one's ever seen before. And in fact, we see New colors added to the rainfall map, guys. New colors. They had to add new colors. This is 50 inches or more of water. 50 inches. Okay? We're measuring rainfall in feet here, not inches, really. 40 to 50, 30 to 40, you know, that's pretty amazing. This is considered to be, and I don't know how they figure this out, a 1,000-year flood. That's after, by the way, in the last few years, there have been several 500-year floods in the region. This idea that we can say how frequently floods of this sort are going to occur in the context of a warming climate is ludicrous. It's ludicrous. And I will tell you, the people that I know, again, you know, Joey across the street from my dad, he thinks a 1,000-year flood means another one won't happen for another 1,000 years. That's what he thinks it means, you know. And so, you know, how we communicate about this is very much lacking. But this is colossal amounts of rainfall over a very large area, which is why this is catastrophic. I mean, there was, of course, some tidal surge. This is, by the way, where Daddy lives, in this little area here in Galveston County. And what happened initially with the bios is that the level of water in this bay, which is called Galveston Bay, went up about 4 to 6 feet. The bios actually are kind of like tidal flow things, you know. So while you're getting 50 inches of rain, you also have the bio rising 4 to 6 feet. The water doesn't really have any place to go. You can't just pull a plug somewhere. But the second phase, which was even worse, is that the rivers that flow down into these areas, the reservoirs that protect from floods, filled up, overfilled, and you know, the threat of a catastrophic release, which is what happened in New Orleans, meant that they had to release a lot of those waters, and a lot of neighborhoods flooded because of that. But you know, when I went to help him, I actually came in via Austin, which is up here. And I did that because I wanted to actually have a car, and I knew I wouldn't be able to get a car in Houston, okay? And so that gave me the opportunity to drive across the state. And I saw major flooding in this region around Columbus and LaGrange, you know, around, or probably should be LaGrange, but in Texas it's LaGrange, which, you know, probably, you know, due to the Colorado River just backing up all the way to there. And so, you know, this was an event that certainly, you know, we've never seen, but does that mean it's unpredictable? No, it's not that it was unpredictable. There were kind of a unique Texas thing, more than 1 million extra pounds of toxic releases just from the East Houston region alone due to shutting down and restarting petrochemical plants. When you restart those plants, it's like when you restart an old car. I don't know if any of you have ever, you know, the old-fashioned cars, you start it up and there's smoke that comes out at first. Well, these plants are like that. And who knows what else was released that was toxic. They'll be studying that for a long time. A unique Texas risk. This is, I think we should name him Harvey. Harvey the alligator, found in somebody's home. He comes back after the flood and the little guy's under his desk. But you can also get a glimpse of the kind of destruction that people see. And this is what I saw way too much of in my daddy's house, just, you know, broken stuff and soaked drywall and insulation and just everything turned upside down kind of thing. And way too much for an 87-year-old to deal with, which is why I went back to help. And so there's a lot of infrastructure damage. I don't know where we're going to come up with the money to repair all these drinking water systems, wastewater treatment systems. The amount of waste, as I was leaving, I already saw the piles of trash accumulating along Interstate 45, just because what do you do with soaked drywall and insulation and all the rest of that? It's just trash. It's good for nothing. Some of the cars that were destroyed, you can use some of those parts that will go into the used parts system. Some of them will end up being recycled onto used car lots, and you know, people are going to have to watch out for scams around that. Rebuilding the damaged parts of the healthcare system certainly is a major priority. So I'm going to go quickly now. I saw the 5-minute sign. But some of the things that clearly did not work is that many people had no escape plan at all. They had no plan. And if you have people cutting their way out of their roof to get out of the attic because their house is flooded, that is an indicator of no plan. You know, mixed messages, I mentioned that, inadequate shelters, no planning to shelter those people or to get them out. Transportation routes, there's been no intelligent design around the routing, about getting people out. And the extent that there is, the people who live in the region don't understand it. They don't understand it and they're not using it. The medical care system, except right at around the Houston Medical Center and vulnerable infrastructure, fortunately, you know, the power was on, but water and waste systems were terrible. A place like my dad's home, drinking water comes from a well, his own well. That, you know, waste is disposed in a septic system. This is true all over the Gulf region. And a lot of people, like my dad himself, don't really understand, you know, that like they're operating an anaerobic digester system. Dad doesn't think about it that way. He just, you know, it's just the thing that's in his yard. What may have worked, the internet had an enormous impact. I mean, just another anecdote. But the lady from whom we got a car from my dad lives about a mile from him, it turns out, just a coincidence. Her house flooded, but she was on Facebook all day connecting people who were trapped with people she knows in the community who had boats and getting them rescued. Now I would say my first step was I called the local police and fire people. I got a person, a very nice lady. She's the only person on the phone in this small community. She was answering every call. While I gave her my report, she had to put me on hold twice. She put my daddy on the list. She couldn't tell me how they would get anyone in there. They didn't have boats. She couldn't tell me when or where they would take him. So, you know, I made a different arrangement, you know, kind of, you know, more kind of redneck style. Get the old aluminum canoe, get the guy Joey with his truck, get him to get as close as he can, get the brother in there with the canoe, get him on the canoe and haul him out there, and that's how he got out. The formal response system was not prepared for this, at least, and they were not coordinated with larger jurisdictions around them, you know, to help them. You know, they were just there. Public health leadership was fabulous, and the messages that they put out, they really did an outstanding job. And really for the first time, I saw primary care workers and mental health workers deployed and to a much greater extent to the shelters to address the chronic health and mental health needs. And you know, some of the stories we heard from Sandy, where people weren't even allowed to use their license from one county to the next, you know, which was absurd. You know, one county couldn't help another county. That was not happening in Texas. Unprecedented involvement of volunteers. This is the so-called Cajun Navy. I should say they're not all Cajuns. There were Asians, there were African Americans, there were Hispanics. You know, this is a very much a multi-ethnic area, and they were all out there helping each other out. It didn't matter, you know, who they were. They were just out there participating in this rescue. All right, these are the paths of all the storms in the last century and a quarter going into the Texas Gulf area. And I show this to illustrate the point I'm making, which is that something happening anywhere is a lesson for people everywhere. Everywhere. There's nobody that's safe. Hurricanes don't know, oh, Galveston had the 1900 storm, that's where I'm gonna go. Hurricanes just go somewhere, but you know, things that we learn from one, we should be applying for all, and we don't. The costs, the escalating nature of the costs, the fact that already Harvey is topping Katrina and Sandy, and who knows how high it's going to be. And then finally, the public health impacts, which we don't know yet. We still haven't reached all the areas that are affected. We can't even count all the bodies quite yet. And the long-term impacts, which we need to understand, not only what they are, but how do we prevent them? How do we prevent the long-term impacts, you know, in terms of chronic disease, mental health, and the rest of that. So I know I'm at the end of my time, And, but thank you so much for the opportunity to talk to you today.